Hello, I'm Don Walker, and I'm Communications Director for Brevard County Government. And we are here today for our biweekly update on the COVID-19 pandemic. We have several folks on our panel today, including Maria Stahl, who is the Administrator for Brevard FDOH. We have John Scott, our Interim Director of Emergency Management. Mark Schillmeyer, the Chief of Fire Rescue. We have Matt Wallace, the Director of Public Safety. We have Catherine Allen, who is with Brevard Public Schools, and we also have Jesse Ray, who's our social media specialist, and we'll be monitoring your comments and questions during our Facebook Live event, and we'll pose those to us during the event. And we have a special guest today, Ian Golden, who is our Director of Housing and Human Services, who's going to give you some information on some very important dollars that the county is going to receive to help folks with rental assistance. So we'll start the day, as always, with an update on the pandemic from Maria Stahl with the Florida Department of Health.
Good morning, everyone. As Don said, I'm Maria Stahl, the Administrator at the Florida Department of Health in Brevard County. I'll give you an update first on where we are with the actual COVID cases. And these numbers are as of yesterday. Today's numbers are not published yet. We have 24,917 cases, and that was an increase of 322. Our labs are reporting out yesterday at a 7.08%, and I can tell you overall, our percent positivity is 12.46%. We currently, unfortunately, have had 561 deaths associated with the COVID, and still about half of those are related to long-term care facilities. Our hospitals are busy. Their capacity has increased. However, they are stable and still have capacity. They are not overrun. Our two-week positivity rate is at 11.2%. We've had 2,031 cases over the last 2 weeks, and our average age continues approximately in the 40s with that. And the next thing, I will talk a little bit about our vaccines and our vaccine rollout. As everyone is aware, I think last time we met, we weren't even talking about the vaccine rollout yet because we didn't know when that was going to happen. But the week before New Year's, we did start getting some vaccine, limited vaccine. The vaccine truly is in limited quantities right now. And currently, we are following the executive order issued by Governor DeSantis. And those people that are able to get vaccine at the current time are those frontline healthcare workers, those over the age of 65. So those are primarily the people that are being immunized at this time. I can tell you currently in Brevard County, 19,073 vaccines have been administered, and we are number 10 in the state with the number of vaccines that have been administered to our residents. And it is not just us at the health department that's doing the administering. The hospitals have gotten doses. Brevard Health Alliance has gotten doses. The Veterans Administration has gotten doses. So it is a joint effort really in our community. The one thing I need to say is please, please, please be patient. I know everybody wants the vaccine today. That's not possible just due to the allocations that we're getting. We do not know any more than 1 week ahead of time what our allocation is for the week. But our mantra is get those shots in arms. So we're not holding back doses. We're getting the doses in arms as fast as we possibly can. When our allocations start increasing and there's more providers in the community giving the vaccines, we will be reaching out into some communities, whether it is the elderly population communities or high-risk communities to give vaccine. Currently, there is just 2 vaccines approved for use, and it's the Pfizer and the Moderna, and our county has predominantly gotten the Moderna. I believe Health First's last doses were the Pfizer. So we have been working with the different EMS providers in our county And I know Chief Schulmeyer will talk a little bit more on that. They've been out doing their workers and assisting us in our pods tremendously. So that's what I have on the vaccines. John, do you want to say more?
Good morning. My name is John Scott. I am the Interim Director of Emergency Management for Brevard County, and I want to start by saying thank you. We know this process has been stressful when we talk about vaccines. We know there is a really remarkable level of interest in the vaccine, and we really appreciate everyone's patience as we go through this system. I want to hit a couple of things as we sort of talk, which is first, and I want to build on what Maria said, which is where we are is a supply problem. It is sort of that simple. We have approximately 150,000 folks over the age of 65 in this county, and we're getting 1,000, 2,000, 3,000 doses a week to solve that problem. So that is inherently where the rub is. Now, obviously, we get that allocation from the state of Florida, and they're competing with all the other states to get that allocation from the federal government. So there is just such a small supply, not just nationwide, but globally for the COVID vaccine, that it makes it difficult to get the kind of large numbers out that are going to allow us to solve this problem in a quick and efficient manner. So when we talk about the supply issue and how we have to compete, that really is the driving force behind things. We've done a couple of different systems. When we first opened the appointments, we had online, or we did a phone appointment through the health department, and just some numbers there. And Maria, I'm going to just hit the numbers again because I think they're worth mentioning. The day we opened the appointment line at the health department, they received over 88,000 calls that day. The following day, when we had the appointment line open, they received 171,000 calls that day. That is a tremendous, tremendous surge. It pushes phone line infrastructure. It is one of the reasons why folks called and they got a message or a busy signal or things like that. Just the core infrastructure of the phone system struggles to keep up with those things. That's why we went to the Eventbrite system and an online option for folks, and we saw that go very, very quickly. So those are the kinds of things we're looking at. But I want to talk about a couple of successes while we're here. One, when we first started doing appointments and looking at what we thought our capacity a day was going to be, and we were thinking it was in the 1 to 250 range. Within the first week, the health department was able to dramatically increase their daily capacity to about between just a little above 700 a day, and we continue to work to refine that to grow that capacity. So as soon as we realized that, we worked with everyone as fast as we could who had made appointments already and began the process of moving people up. So in line with that, as we got more doses this last week, if you saw yesterday, we opened up another 1,000 spots based on the new vaccine we had. So we are really getting vaccine out and getting shots in arms. I know it doesn't necessarily look and feel that way to the majority of people, and none of this helps those who are waiting online and trying to get appointments, and they're, as fast as they're clicking, they're gone. Yesterday we all 1,000 spots were taken in about 6 minutes. So it really showcases the demand. So we really need folks to be patient. I know that's easy for us to say up here. It's hard for folks to do when they're online trying to work this process. I know for lots of folks, especially our seniors, a vaccine not just represents hope, but it represents a return to normalcy. It talks about the idea of being able to go see your grandchildren again, being able to get out and be more social, and that's important for all of us in the long-term mental health. We want to get there as fast as we can, but we really have a supply issue. As that supply opens up, you'll see us do more things. A lot of the stuff that people want, are asking, can we do? Can we get out to communities? Can we go to those areas that are underserved? The answer is, as soon as we get the supply, we're going to be doing that. What are we doing right now? In addition to working on, just refining our operations and getting more shots in arms at the Department of Health and supporting our EMS operations, we're planning, as more shots come online, building those capacities through partnerships with local health care providers and looking at places we can go in communities that when we have the supply, we can get that out to meet that demand. So, again, I know it's frustrating. please know that we will hear your pain and understand your pain. We know that an online system isn't perfect for everyone, and that we're not reaching certain people. So we're engaging with both public and private sector partners, including the state, to figure out how do we get a call center in place that can handle the kind of volume of calls that we're seeing. So know that we're trying. Again, I know it's not great news that, hey, we're not going to be able to solve it, but as soon as we get the doses that we're looking for, as soon as that supply comes in, we are opening spots and we are getting shots in arms. As that supply increases, we are building the capacity to keep up with it and to push even more shots. So what I'm asking for is your continued patience, understanding as we go through this process, and know that we are working tirelessly to get out as many shots as we can. Don?
So since John mentioned that the county's working on building for capacity and getting ready for additional supplies, I'm going to turn it over to Matt Wallace, our Public Safety Director, to talk a little bit about action our county commissioners took this week that'll help in that effort. Matt?
Thank you, Don, and good morning, Brevard County. Thank you again for tuning in with us this morning. These information sessions are just so critical as we just get the information out of the plans and actions that we're doing as your Brevard County government team to make sure we support the community as best we can. And that was a great transition that, John, that was a perfect overview of what you gave of where we're going. So I know your next question out there in the county is, well, what are we doing to expand that capacity? Every county has been encouraged by the state to demonstrate an expanded capacity, and if you can show that, the state will then, I hate to use the term reward, but give those counties who have extra capacity the ability to get more shots in arms per day. They are in line to receive more vaccinations. So if you were tuning in with us on this past Tuesday on January 12th, the Board of County Commissioners approved up to $2 million in public safety funds to expand our vaccination operations for up the next 6 months. So we are going to be going out and looking at healthcare providers and partners and any opportunities that we have out there to use those dollars to expand our current vaccination program. I want to hit one more time what John had talked about earlier too. In our county, we started off this process, we were doing about 100 or 200 shots a day. Through some process improvements and things that we've done, working with the Department of Health and their fantastic all-star team, we're up to 700 a day. We're doing things right now to look till we can even get that past that 700 and get that to 1,000 or more a day. This action by the commission will put more vaccine capability on top of that, let's say 1,000 shots a day. And now our goal is to, with this action, is to get to maybe 2,000 shots a day or more by working again with our community partners and vendors and all our hospital administrations teams, all our teams out there. We will leave no stone unturned to see if we can use these dollars most effectively to expand our operations to put more shots in arms quicker. And again, that will in turn allow the county to be more competitive as those vaccines become available from the state. We will still target the same population until the governor's changes the regulations. We're shooting, no pun intended, for the 65-year and older age group. And then once the governor and the executive sessions in the state change those requirements, then we will change accordingly again as the county, and we will react to those. But I think it was a great thing that your commission did. They understand the problem. We're putting those public safety dollars to address that problem, and we're out there to make sure that we get shots in arms, as John has said, as quickly as possible, depending on what that logistical supply chain issues that we have. But we're going to have our county in a position to make sure that we're very reactive. So that's all I have, Don. I'll turn it back over to you. And again, thank you for tuning in with us.
All right. Thank you, Matt. So as I mentioned up front, we hold these events, these Facebook Live pandemic update events on a biweekly basis. And this is our first update for 2021. One of the things we talked about a lot during 2020 is $105 million in stimulus that the Federal Treasury Department passed out to counties across the United States. Brevard County got $105 million of that stimulus money, and we've used that money in a sundry of ways, including helping small businesses that have suffered losses, helping people with rental and mortgage assistance, food stability programs, and one of the things that the county is also continuing to work on is spending that money out in our community to help those who are in need. And that was some other action that was taken on Tuesday by our Board of County Commissioners. in terms of rental assistance, and we have Ian Golden with our Housing and Human Services Department here today to talk a little bit about that program. Ian?
Good morning. I think it is actually still morning. Yes, on Tuesday, the Board of County Commissioners authorized the county manager to submit the documents necessary to accept a little over $18 million from the Treasury for a emergency rental assistance program. That number is an estimate at the moment. Treasury hasn't given us a final number yet. That estimate came from the National Association of Counties. This legislation, however, did have more detail associated with it than the previous CARES Act legislation. So it is specific to the type of services that can be provided. It's rent payments, it's past due rent, it's utility and home energy costs, those past due costs associated with that, and then some other category that we have asked for more definition and clarification from the Treasury regarding. We're hopeful that that other category will allow us, if a renter is in a eviction with the court, there are usually court fees, attorney's fees, things along those lines that we're hoping that that other category will cover for us. It's also specific to the income limits, 80% and under. So for Brevard County, 80% of area median income for a family of 4 is $55,350. They have priority areas that we're supposed to look at. That are those families, households that are under 50% of area median income, which for a family of 4 is $34,600. Also, a priority area is any household that meets those other criteria. And then there is also someone in the household who has been unemployed for the 90 days prior to the application. As for the application itself, we are currently looking at bringing to the Board of County Commissioners on the 26th of January at that commission meeting a policy and application for their approval. We anticipate that the release of funds from Treasury will occur that same week. So either that week or the first week of February is when we would probably look at opening this program to applications. We're looking at partnering with community agencies, other municipalities to try and help us process. And we also, unless we get more direction from Treasury, which we don't anticipate getting until the funds come out, so we're kind of building this program in the dark. But we're hopeful that as we get more direction from them, we'll be able to reduce down the amount of documentation potentially that's needed to verify and make families, households eligible under this program.
All right, thank you, Ian. A couple other updates we'll have from Mark Schellmeyer, Chief of Brevard County Fire Rescue. Mark?
Good morning, afternoon. So following the governor's guidelines, Brevard County Fire Rescue started vaccinating our employees, our EMTs and paramedics, and our frontline healthcare workers. And we've been doing so since last Wednesday, making appointments for our own people. In addition, we've been doing a couple different other municipalities in Brevard County as well, and we'll continue doing it as long as the interest is there. We can make appointments. In addition, Brevard County Fire Rescue has provided additional resources to the Department of Health to increase the throughput at their facility in Vieira, Florida, and so we hope to help them help our community.
All right, thank you, Mark. And we also have from Brevard Public Schools, Catherine Allen, who does media and publications. Catherine?
Thanks, Don. Again, my name is Catherine Allen with the Office of Government and Community Relations for Brevard Public Schools. We've had 1,475 cases since August 31st in the school system, keeping in mind that we serve over 70,000 students and have over 9,000 employees. Things are holding fairly steady. Again, though, our schools are a microcosm, so when there's additional spread in the community, you're going to see it in our schools as well. But our administration teams and our site teams are doing a phenomenal job with social distancing and mask wearing, and our students are doing an amazing job as well. So we're working the best that we can with it. We understand that it's not a perfect system, but we're really pleased with the relationship that we have with the Department of Health and just, continuing to work on that response protocol. And that's pretty much all we have for the schools. Just noting we are off school for Monday in observance of the Martin Luther King holiday. and there will not be food service provided on that day.
All right, thanks, Catherine. So as we normally do at the end of these events is we have Jessie Ray, our social media specialist. During the course of this event, she's been monitoring comments and questions that have been posed, and we will have some of those. We'll try to answer some of those questions starting now. Jessie?
Thanks, Don. Okay, so first, I think this one is going to be for John. Other than the supply and demand disparity, what have been some of the major challenges in the county's COVID-19 vaccine distribution?
Yeah, so thank you, Jesse. A couple of things I'll hit on. Probably the largest is related to the supply and demand issue, which is managing expectations and trying to help folks understand as we go through this what our realistic and implementable options are to meet that high demand with our low demand. So that's been a challenge for us that we continue to work on. We continue to try to find new ways to communicate on. I touched on the idea that we know an online system isn't all things to all people. So we're trying to work through additional solutions for that to find those folks who either don't have access to internet or maybe not the most savvy when it comes to navigating the internet. And we continue to look and find ways for that. I also, again, will hit on the idea that, we started out with a bit of a capacity challenge. We weren't sure how we would be able to do that. But very, very quickly, through, again, the excellent work of those at the Department of Health, we were able to not just overcome that capacity, sort of where were we going, but quickly get to a dramatically higher number in that 700 range. So I think that's a success of what we're doing. And we're learning every day. We meet every day as a team with those people who are involved in the operation and talk through what went well, what didn't go well. And we'll continue to try new processes that make us more efficient. And if that process doesn't work, we will put that in the garbage and we will find a new process and work forward. So we continue to learn lessons.
Thank you. Maria, what do you attribute the recent spike in COVID-19 cases to, with 300 plus new cases reported almost every day?
Yeah, and that is absolutely true. We've definitely, and not just our county, but statewide, and actually nationwide has seen a spike of cases. We've had most days now over 300 cases. We've actually had a couple days of over 400 cases. We are not seeing any big cluster in any one location. So the only thing that we can truly attribute it to is more spread in the community. We are now about 2 weeks post-holidays. So I am probably pretty sure a lot of this is related to even leftovers, contacts from Thanksgiving, and then the holidays, and then the New Year's. And I have to really, really impress, just because vaccines are rolling out does not mean that we need to stop our mitigation measures. So masking is important, social distancing is important, hand hygiene is important, and staying home when you're sick is important, just like it has been all along. Because we truly, truly, truly are seeing more community spread.
Awesome. Thank you. Also, Maria, is the DOH clinic in Viera open for things other than the drive-through vaccination program?
Yes, right now we did scale back on a few of our clinics for 2 weeks while we got our vaccine operations rolling up. But due to some state teams that came down to help us, along with Chief Schulmeyer's staff, we are able now, and it's all 3 of our clinics, not just Viera, because we did have to pull nurses in from the other clinics. But starting next week, all of our clinics will be opened up full capacity, in addition to our vaccine operations.
Awesome. So, John, this is probably for you. People who aren't Brevard or even Florida residents are able to get a vaccine here in Brevard County. Why is that?
Yeah, I know there's a lot of frustration around residency and all of those things. As Maria touched on, we follow the governor's direction on this at a local level. Our job, the governor sets the priorities, the federal government provides the vaccine, and our job is to execute those as well as we can. And the governor and all the way up to the president have said, this is a federal vaccine purchased with federal dollars, so it is available for those residents, from wherever the United States they are, and we are implementing that. And I know that can be frustrating for folks, but we also know that, there are times where we are one county and there are times where we are one state and one country. And we are in that situation right now. Again, I know that doesn't help when the supply issue is this tight, but as our supply gets better, we hope to see some relief on those things.
Awesome. So kind of speaking about that, so who sets the parameters of who can and can't get vaccinated, and when do you think we will see the next phase of people who are eligible to be vaccinated?
Yeah. So as I mentioned there, so the CDC makes recommendations at the federal level in partnership with Operation Warp Speed and the White House Task Force, and then those are left to the state to really finalize. So the governor, the Department of Health, and the State Department or Division of Emergency Management are the ones who work together on that. Ultimately, it's the governor who says these are the priorities for Florida. And then as far as when the next group is going to come, I mean, that really is a governor's decision based on that. I would imagine it'll have a lot to do with where we are supply-wise and how we're doing with the current groups. But again, that's not necessarily a concern of ours. Our job is to make sure we have the capacity to get out as many shots as we can. And if the priorities change, we will adjust, continue to build capacity, continue to get shots in arms.
Awesome. So emergency management said they were going to let residents know when more vaccine appointments were available. So why didn't they tell us when Health First and Omni got vaccines?
It's a great question. So when we let residents know when that stuff is available in an area that we control. Both Omni and Health First worked directly with the state of Florida to get those 2,000 doses each got. Both of them had ways to schedule appointments for that, and both of them did their own announcing. One of the things we always want to make sure we're doing is we're keeping as much information clean as we can so that we're not putting out information and people are trying to come to our site to sign up for Health First. So we let Health First announce it. When that information came out, we certainly shared it. But we wanted them to take the lead as it was really their doses, and they were the ones scheduling and providing.
Okay, thank you. Sorry, I was trying to understand a question. So we get this question a lot with the Eventbrite, and if you don't mind, I think I'll take that really quick. So people ask all the time, so why does the Eventbrite show that there are appointments available, and then you click on it and it says it's unavailable? So the reason for that is there's a 30-minute window that is built in. So if Don goes on and he's making his appointment, he has 30 minutes to complete his reservation. If he doesn't complete it in that 30 minutes, it's going to kick him out, and that ticket is available yet again. And so what it's showing you is that technically his ticket is available until he either finishes it or gets kicked out. But once he has completed his registration, then it will show that it's off, it's sold out, there's no more tickets available. So we understand that's definitely frustrating. It's Eventbrite, it's not our website, so there's not much we can do about that. But I always suggest to people to maybe not start with the very first ones that you see, but if you're running into that problem, scroll down to a later date and time and try and find something there. And last but not least, and I don't know that this is something that we can really answer, but why are the supplies so low, and do we know how many are being manufactured in a day or a week, or do we know any of those kind of details?
No, the short answer is no.
Yeah.
We don't have visibility on that. Again, that happens through the federal coordination. They are taking the lead on the supply side of things. Our focus is making sure we're getting shots in arms. I know I'm going to sound like a broken record all day on this, but as we get more supply, we will get more shots in arms, and we will continue to build the capacity to make sure we are positioned to do so.
All right, and last question. So people have seen that the governor is running a pilot program with Publix, and we know that he's done a couple, starting kind of in the northern end of the state. When do we think we're going to see a larger rollout of that? Do you have any details on that program?
So I'll talk a little bit about it. We know a little bit about it. Obviously, we've seen it rolled out across sort of in portions of the state. I know that they were trying to hit some rural areas first, that the governor has said that in his press conferences on that. I think as they are able to get more supplies, again, Publix is pulling from the same state supply that we're all counting on to be supplied from. So as more is available, I'm sure they will expand accordingly. I think everyone's goal, and I think the governor's been very clear on this, we've been very clear on this, our goal is to have the kind of supply that where you would normally go to get your flu shot or whatever other vaccines you're getting, it's that available. So it's in our Walgreenses, our CVS, our smaller mom and pop pharmacies, our doctor's offices, our urgent care centers, where our health system normally is, it's available. But like we've also said all along, it's going to take us some time to get there, and we're going to need everyone's patience. As that supply gets, opens up, those are the avenues we want to get it to. We right now are serving as the bridge with the sort of that limited capacity to still get it out in as efficient way we can, but it's going to take some time.
Thank you, John. So I want to end it with just one quick thing. We get a lot of questions from people. How do we find out when there's new appointments available? So one of the ways that the county uses, and the best way probably that you would find out, is we use an online system, or excuse me, a phone system. It's called Nixle, but we call it Alert Brevard. But it's on your phone. You would create a text message. So for example, you're sending Don Walker a text message, but instead of Don Walker, you put 888-777. And then in the text box where you would write me a message, you put in Brevard EOC, one word. And you put that in there, and you'll get a notification that it's activated. And next time we put out an alert that there's going to be appointments available, you will receive that on your phone. We'll give you ample notice where you can get online and get those appointments made. So that's the best way to find out when our latest round of appointments will be. And hopefully we'll be putting those messages out more often and in the days ahead. Thank you very much for joining us.